The 5-point basic ophthalmologic examination. Visual acuity, gross examination, tonometry, extraocular muscle examination, fundoscopy. Distance visual acuity. The Snellen chart is used with a distance of 20 feet from the patient. Test one eye at a time. By convention, start with the right eye. Make sure that the patient completely covers one eye. If the patient is wearing correction, make sure that it is removed first. You have to start from the biggest letter, going down until the last line that the patient can read. If the patient makes a mistake, continue with the next line until he cannot read at least half of the letters. If the patient cannot read the biggest letter of the chart at 20 feet, ask the patient to come closer to the chart until he sees only the biggest letter of the chart and record the distance. We'll record the line that the patient can read without corrective lenses. Again, this time using the corrective lenses, and record the line that the patient can read with the corrective lenses. If the patient does not have corrective lenses, proceed to testing using the pinhole. This is the visual acuity of our patient.
Gross examination. Inspect the lids and periorbital area. Note any abnormal findings such as hemorrhages, redness, and skin lesions. Palpate the orbital rim for fractures and step-down deformities. Check for hypoesthesia of the cheeks. Check the conjunctiva for signs of infection, inflammation, or foreign body. Check the Hirschberg reflex for eye deviations. Check the pupil for direct and consensual light reflex. Check for relative afferent pupillary defect or RAPD.
These are the results of our patient.
Tonometry by digital palpation. Palpate the eyeball using index fingers with patient looking down. Normal intraocular pressure is 10 to 21 mmHg. Report as soft, same as the tip of the nose, firm, same as the forehead, and hypotonic, same as the lower lip.
These are the results of our patient.
Extraocular muscle examination. By finger following test. Assess for the 6 cardinal gazes, rectus muscles, and oblique muscles, each eye and both eyes. Grade movement from 1 to 4. Check for nystagmus, pain and movement, or diplopia.
These are the results of our patient. Direct fundoscopy. Check that the direct ophthalmoscope is working properly. Should check the light source and use the largest diameter circle and adjust the lens setting to 0. The patient must be comfortable seated or standing and must be looking at the distant target throughout the examination. When examining the right eye of the patient, use your right hand and your right eye and vice versa. You may adjust the lens power of the ophthalmoscope to correct for any errors of refraction of the examiner and the patient. So start from 1 foot of the patient and locate the red-orange reflex. Slowly come closer to the patient at an angle of 15 degrees temporal to the patient's line of sight. And then when the retinal vessel is seen, follow the vessel nasally until the optic disc is seen. These are the results of our patient.